Good afternoon. My name is Rachel Leventhal-Weiner, and I'm the Office of Early Childhood's Chief Research and Planning Officer. We thank you for joining us this afternoon for a discussion about youth camps and the COVID-19 emergency. And I'm here today with Commissioner Bye. She's going to provide remarks and an address, and then we will be fielding some questions from all attendees. Attendees are in listening mode right now, but you can send us questions using the questions feature that should be on your screen with the GoToWebinar software. So with all of that, Commissioner Bye.
Thank you so much, Rachel. Thank you for helping to coordinate this, and welcome everyone to today's conversation. We think it's a first conversation as this is a pandemic and things are changing very quickly. My name is Beth Bye. I'm the Commissioner at the Office of Early Childhood, and I have many years of experience in childcare and also many years of experience as a camp director. I've been corresponding with some of you, and I certainly know your world. At the Office of Early Childhood, we're grateful to have this opportunity today. I'm really also grateful to the OEC staff who did some work on Memo 18 that we issued last week that I'm going to review with you today. I also wanted to say, you are also on Governor Lamont's mind. He has appointed a Reopen Connecticut committee, and Commissioner Cardona and I are on it. And we have plans to have a conversation with the governor about camps in the coming week. And this afternoon, we have a Reopen Connecticut committee meeting. So while OEC is a regulatory authority, we know that many camps happens in cities and towns and schools, and what schools do will also impact how you behave. So we realize that there's more than one agency that you're working with here. So what I'm going to do is I'm going to walk through Memo 18. I'm not going to read the whole thing because I want to leave time for questions. And then we will take your questions, and I'll do my best to answer them today. And I have some staff from our licensing department who can help as I need. But then what we do after these town halls is we will create a frequently asked questions list and post that on our website. I just want to begin by saying there are a lot of things we don't know right now. 2 months ago, none of us could imagine maybe we'd be where we are today. And I would say 2 months from now, we don't know where we're going to be. So on June 29th, we don't really know. So, but what we can do is give you the most up-to-date information we have, and that is what we work to do with Memo 18. Because so many of you are calling us with guidance. So what we're asking you to do is continue to look at the memos on the OEC website. They're updated regularly. So I'm reading to you today from Memo 18. Memo 6 was just updated with really important information about public health practices and face coverings and things like that. So I think it's important that you keep track as we issue memos. And I should apologize for sending so much communication, but I won't, because we don't really think we can communicate too much. These are based, Memo 18 and Memo 6 are grounded in the current CDC guidelines for childcare and schools. Camps deal with young children, I know some of you, and you deal with school-age children. So that's the guidance that's available to us right now. We understand that there will be additional guidance potentially coming related to camps, and just like we did for this guidance, we will look to the most current guidance coming from CDC. We'll work with our State Department of Public Health to update. So please keep up with our memos. Governor Lamont has been really clear that childcare is deemed an essential function and has not mandated that childcare facilities close. As recently as today, this afternoon, I had an email from another commissioner in another state saying, what are you doing about camps? And while we don't know 100%, some states have closed childcare. Connecticut did not. And in fact, some youth camps stepped up and have opened their programs today, operating under their camp license to help with childcare. So we have not ordered any programs to stay open either. So we know that you're all making difficult decisions right now, some of you with your board, some of you with your towns about what to do. So we urge you to, you as well, go to the CDC website, talk with your local health, et cetera. But there are some specific provisions in place right now that were not in place prior. We've waived some requirements and we've added some requirements. So when people are entering a child care program now, and that includes a camp under our licensing, all staff and children are required to be screened for illness and make sure they have temperatures below 100 degrees. What's come up in childcare is some of the strict guidance about the personal protective equipment needed while taking children's temperatures. And one of the things we've worked with childcare programs on is suggesting that they have parents take their temperature upon arrival, which reduces the need for staff to do that and to use PPE. The other thing is, so there's more in Memo 8 about all of that. And if they have a temperature above 100 degrees, they are not permitted into the program. The other big change, which will impact camps that's in place right now, is that group size can be no more than 10 children, and program size more than 30 requires approval from the Office of Early Childhood. So that was in Memo 15. Again, the whole goal here is to reduce exposure to children. So there's program size requirements and also classroom, if you will, size of 10. We have had about 50 applications for those greater than 30 programs, and we are asking that they can show how they can separate the groups so the children are not, the children are separated into smaller groups and not bumping into each other, not using the exact same equipment unless there is disinfecting, et cetera. So there's a application there. We are also making sure you have a place where children who are sick can be separated and wait for their parents to pick them up. And then as issued in Memo 6 and also here in Memo 18, that employees are to wear face coverings in the workplace, and that cloth face coverings are okay. And there are places people can go to look for guidance about how to make face coverings. The point of wearing face coverings, it obviously helps maybe prevent you from getting the virus, but it's more about not passing the virus in case you have it. There's also important guidance about hand washing and the use of soap and water and hand sanitizer. Also information about coughing and sneezing, not into your hands. And we are asking programs that they have protocols for intensified cleaning. We're also asking for strategies around social distancing. We know that this is challenging, but we do have childcare programs open now who have been following this guidance, and I think doing a super job of that. So we know it's possible. If there is a case of COVID-19, camps need to notify local health and state health so that they can follow up, because this is a big part of how we're going to beat this. So also in Memo 18 is just checking in with your local health departments and giving them all the information they need in the case that you have a positive case of COVID-19. We know that these are really difficult to implement, and for residential camps even more so. But they're in place now to ensure ongoing operations during COVID and to protect the health and safety of children and staff. I have issued waivers to sort of ease some regulations, and those are as follows. That licensed camps can extend their operating days, and to adjust for school changes and other such things. That health and immunization records on file before the state of emergency for children in camps, which may expire during the state of emergency, are acceptable. We understand that it's very difficult for families to get some of these. Same with staff training and CPR. If they expire during the state of emergency, they will count as fulfilling the requirements. Same with staff physicals. So on the fingerprinting, right now we have suspended fingerprinting, and Care for Kids camps that accept Care for Kids have to still complete background checks using the DCF authorization form. But at this point, we understand that getting fingerprints is not something that's feasible. One of the challenges I know we're hearing about from you all is that your licenses that are due up for renewal are non-refundable. And those go to the general fund. The renewal fees paid are for 1 year, and they can't be carried over either. These are all sort of regulatory and statutory rule. What we are suggesting is that camps can wait and decide to delay their submission of the renewal application and allow the license to expire, and then we will work with you quickly to reinstate such a license if you make a decision to operate at a later date. Takes several days, so we need a little lead time, but we know that you are thinking weeks and months ahead right now, trying to operate. And I just want to close my comments by thanking you, because you're on this call because every day during camps, you're trying to both take care of children, to enrich their lives, to educate children. This is what gets you up in the morning. And this has left so much uncertainty for camps that really just have one season during which to maintain themselves financially. So we recognize that you're under stress, and we want to work with you. We believe that camps play a really important role in the lives of families and children. And we're doing this today so we can hear from you. We can hear your questions. We can hear your concerns. You may say, I just want to tell you something, so that we can address it. And when Commissioner Cardona and I meet with the governor, we can give them a full picture, he and his whole team, about this. But I know he's really grateful for your willingness and for you being on this call. So I'm just going to ask my staff if I missed anything, Mike or Deb or Valerie or Keisha. Did that cover most of it, or anything to add?
I believe it covered most of it. Certainly the questions that we get might touch upon some things in a little more detail.
Okay, great. So Rachel, are you going to read me the questions? Is that how we're going to do this?
Yes, I can read you the questions, and we see people can still continue to submit questions, but we are starting to see some common themes. So maybe we can start with just around how to receive communication from the agency. There, you mentioned our memos. They are on our website in the COVID-19 section, but if you aren't receiving our memos, we are using the communication that we have through the e-license system. So if you have not received communication, that's something that, how should we go about that?
That's a really great question. First of all, if you are not receiving our memos via email, then please check in with our licensing division and have the email in the system changed to reflect the proper email, because we do have technology in the place where we're emailing directly to programs. Or maybe you're opening a new program, so you might not be in there, and you can just let your licensor know that. And the website, we are staying totally on top of the website and updating it every single day. And so you should be able to find the most recent memos, all there listed under memo.
So let's start with, there's several questions around transportation. Our stance, and I think the transportation questions really mostly relate to busing. So if you could speak to social distancing on busing and the agency's recommendations.
Yeah, that's a really good question. I do not have a recommendation at this point. I have the recommendation of class sizes of 10, group sizes of 30, where you can keep some separation. But this is something that I'll bring back to the team, and we'll talk about. These are the kinds of things that we work through with the Department of Public Health. I'm a toddler teacher and a child care director. I'm not a public health official. So this is a really great question, and I'm sure it's going to come up for schools too. So thank you for that question. And I'm sorry I don't have an answer right now, but we will look into that.
In terms of group size, we have many questions around group size, and if we could just be a little bit clearer.
Sure.
Are adults counted in the group size of 10?
No. No.
Okay, go ahead.
It's 10 children per classroom, if you will, or per class, 30 per program. So as you know, there are many child care centers in Connecticut with 70 or 80 children. Most of them are not having that level of demand, so they're smaller, but they are now limited to 30. Now, some have asked to have 40 or 50. We haven't really had any say, I want to be 100. But they have to demonstrate that they can, keep the groups sufficiently separated. And again, I don't know what the guidance is going to be 5 weeks from now. I wish I did, but we will continue to follow the public health guidance. The governor's guidance is no groups more than 5. For childcare, we're allowed to have 10 in a classroom. And that's where things are on April 24th. I don't expect it'll be the exact same guidance on May 24th. But right now, that is our guidance. So it is confusing because I say group both times, but basically classrooms of 10 and programs of 30.
And it's important.
With an ability to apply for a waiver if you have more than 30.
I just want to emphasize what you said, Commissioner Bye, because we have many questions saying, do we anticipate changes to the public health guidance or to the governor's executive orders? At this time, we have to operate with the information we have today.
Yeah, that's the hard thing about, we issued memo 18 on April 22nd or 1st. And we have to use guidance that we've just received, and we've just gotten new guidance this week. The face coverings is new guidance. So that's what we're operating with. That will likely change. I mean, it's probably changed at the longest every other week. And I do know from talking with folks at working camps that camps are talking to the CDC and asking for guidance about camps. And that's exactly the kind of guidance we would look to in making any changes. And that's what the governor will be looking to, and our State Department of Public Health will be looking to. So we look forward to guidance specific to camps, but I need to issue guidance now based on CDC guidance for schools and childcares.
So that's a great segue into, there are a number of questions from folks about if they believe that they will operate a program with greater than 30 children. Where can they find an application for approval? And while you speak to that, we have a link to it on our website, and I'm going to put it in the chat window for folks.
Super.
We can share it out afterwards as well.
Yes, people are accessing that through our website.
Hold on one second. Now, maybe we want to talk a little bit about the wearing of masks. Many questions around, do children have to wear masks? Do adults have to wear masks? Masks.
So, yes. Right now, OEC Memo 6 talks about masks. And I'm looking, we had sort of a prepared answer to this. What number is it for my team on my answers? Is it on my document? Well, I can just tell you what
number 5.
Number 5. I can tell you what we've been, saying to childcare programs, that the new guidance from the governor were about workforce, and they were for people going to work. So it is required for employees I think there's a line in the governor's EO that says it is not required for children in childcare. And one of the challenges is, again, the mask is to protect you from infecting others, but it can be likely to get you more likely to get infected if you take the mask on and off and you're touching your face a lot. And we know it can be difficult for children to wear masks. So we've just issued the first guidance on masks related to masks this week. Like the other items, I expect there will be updates, but I do know there was something put in specifically in the governor's executive order saying that children in childcare are not required to wear them. But in many childcare programs, children are wearing them, and kids are pretty adaptable. So again, I can't say what that'll be in a month, and I'm sorry about that, but that's where we are now. I'm going to ask Valerie or Keisha if you want to add anything to that, or nurses.
I just posted the link for the safe workplace rules in chat, and that also speaks to the mask.
Excellent. So there's some information in the chat that is very clear to you. And the other thing is OEC has been working with 4 other agencies to develop really clear guidance about masks that will be available on our website very soon. It was in its final rewrite. I still have to approve it, but then it will be posted as well to give you the most current information about face coverings.
Yes, this is Deborah Johnson. I would just like to chime in here. As individuals read through Memo 18, there are a lot of links in there, but they're incredibly helpful links. And if you go to those links, they give guidance about the wearing of masks, social distancing, screening children, all of those things. So they're really helpful to read through them and get guidance.
Thank you so much, Deb and team, and Keisha. Okay, other questions?
So maybe we could talk a little bit about how, and I think at the end of the call, we'll have to share some information about how to communicate directly about very specialized questions. But we have had a couple of questions around residential camps and whether residential camps can have camp for over 30 campers, and just how some of these things might work differently in that residential camp setting.
Yeah, we understand that things could be different in residential camp settings. For example, group sizes of 30 would be very difficult for you, but I think for many of you with residential camps, you likely have housing facilities that do not have certainly not more than 10 children in a room and not more than 30 children in a setting. I think the challenge becomes how you set up your program to have less intermingling, and we will evaluate each one individually. But if I could sort of put it this way, if I was a camp director, and this is hypothetical, but if I was a camp director and my camp, when I was a camp counselor, my camp had like 50 kids. If all the kids were intermingling all the time and one child had a case of COVID, it would have the potential to shut down the whole camp. But if kids were separated into groups of 10 and did not intermingle and there was a case, it would have the potential to shut down maybe just one. And every case is so individual, I should say. So it would really depend on the Department of Public Health. But what we're going for is to have less exposure in the case that a child does have a case, or that the case that one counselor is diagnosed as positive, but to reduce the spread. That's why all the schools are closed, because of the number of children in schools and the potential of spread. So we're trying to minimize the risk of spread, if you can try to think of the public health guidance as focused on that.
We do have some questions around the age of campers. So are we considering these regulations to apply to camps for children who are over age 13? And also, how do we handle camps where they have counselors in training who would otherwise be above age 12, but younger than, say, 18?
I'm going to ask Mike Curley, if he's on the call, to address that question, because I don't want to misspeak related to the regulations. Mike, are you comfortable answering that, or Deb?
I can.
Okay.
Counselors in training have always been considered campers. So the requirements that apply to campers, they are counted in, for example, the group size of 10. Staff, for example, are not included in the group size of 10. So that's the difference there. There's no cutoff for these requirements at age 13 or any other. They apply to all campers, regardless of the age.
Thank you, Deb.
Thank you, Deb.
We have many questions regarding swimming for the summer and swimming pools and how to handle some of these requirements, social distancing and the wearing of masks during swimming.
Yes, those are really good questions, and what I will do is we will reach out to the Department of Public Health, because swimming is very different than childcare. Swimming does not happen for the most part in childcare programs, so we will reach out with to the Department of Public Health. We are sort of holding with the guidelines as the guidelines are wherever children and staff are, but we do see that swimming could pose different risks related to COVID-19, and I mean that's exactly the kind of guidance we'd be looking to the CDC to provide to states and to programs like camps as summer approaches. Certainly not swimming weather now, my goodness. It's the end of April, it's like 35 degrees, but it will come. And again, swimming is one way that you all literally help save lives, because you teach kids to swim. And we know, sadly, how many children drown each year. So, you know, we see swimming as really important, but we would have to think through some guidance about that. And if you have ideas, feel free to share them with us.
We have received some questions about what happens if there's a COVID positive case detected, either in a daytime program or in a residential program. How do programs handle notification?
Yeah.
Does the residential staff have to self-quarantine?
Yeah, I will address that. And Memo 18 does address this as well. When you look at that related to what you have to do, I'm going to go to the part of that memo, so I am on track. If a child or staff member who has been present in the program is diagnosed with COVID-19, the camp must notify families and staff of the program about the exposure. And in February, that was added to the list of reportable diseases. So those required to report must report to DPH and to their local Department of Health in the town of residence of the COVID patient by telephone on the day of recognition or strong. So it's an immediate report. So contact health. You also have to figure out when the date of the symptoms started, if the child was present that day or how many days around it. So it does take, I'm not going to read through every part of this. It is in Memo 18. But what I would say, having been through several of these myself, is don't assume you know. Even if you told me right now a case and what happened, having walked through it a number of times with programs, every case is so different. You know, we've had cases where we thought, oh, we're going to have to shut the program down, but based on when the fever broke, based on how many days and how many kids and who was in the room, it is really different case by case. And that's why it's so important to work with Department of Public Health and local health. And my experience has been is they call back, if they don't answer the phone, they call back within an hour. What you want to do immediately is get all the details you can get from the parents about when the child was sick, when the fever began, when the fever ended. And we've had situations, another recommendation, not requirement, but we've had situations where parents have not been totally transparent with programs. So you may want to really ask the direct question on the screening on the way in to the parent. Has this child or anyone in your family been tested for COVID in the past week? Just to try to keep an eye on things.
Thanks, Commissioner. So we have a few questions around if licenses have to be renewed, if camps choose to operate in a distance or virtual way.
I talked to from one camp that was thinking through this, which is really quite remarkable. You're already wanting to make sure, no matter what, that you can reach your students. We are looking into that question. Most of our guidance is around physical space, staff qualifications, et cetera. But we will definitely get back to you on that. I think it is an excellent question, and just one more sign of how you all are thinking ahead about how we're going to reach everyone.
Deb Johnson, it sounded like you wanted to chime in on that one.
We have asked, we've been asked that question if a program wants to operate remotely, and we've determined because the children are in their home, at home, the camp isn't assuming responsibility, and therefore that's fine, and the camp does not need to hold a camp license to do that.
There you go. Thanks, Deb.
You're welcome.
So we have a question about the maximum size if people apply for a waiver.
Well, the maximum size
over
is,
35.
well, the maximum size is what's applied for. There are some camps that are on huge properties where children could easily be segregated. So I would say we take each one on a case-by-case basis and look for, public health practices and how children are going to be kept in smaller groups, smaller classes and smaller overall groups.
It's important to note that we're definitely hearing the comments that are coming through in the questions around how every camp is really different from one another.
Yes.
So if you have specific questions about your camp and its operations, it's going to be helpful for you to reach out to our licensing division. We do recognize that there are some camps that are much smaller and there are some camps that are much larger, and some of the questions that folks will have, this is the first of our communication with this group. So we'll try and attend to those in the future. One question we have, Commissioner Bye, is around municipal camps.
Mm-hmm.
Those who will be license exempt. How do these regulations apply?
Well, in those cases, a lot of them are municipal camps, so local health may well have a role, and towns will have a role in deciding what to do. So we do not oversee their license, but I talked about how Commissioner Cardona and I are going to be meeting with the governor about camps. Municipal camps will certainly be part of that conversation, which is why, it needs to be both the State Department of Ed and OEC, because certainly the same public health guidance will be we're following the recommendations of Department of Public Health and the CDC. We're not making any of this up. So it would certainly be my guess that towns and cities would be looking to those same sources for guidance about programs. And I would ask Mike Curley, the executive order, does that apply to all childcare, including exempt, or just licensed?
Yes, so many of the executive orders do apply to camps, whether they are municipal camps or licensed camps through the Office of Early Childhood. Obviously, the executive orders that apply to all businesses or all employees would apply regardless of license status. And some of the specific childcare requirements, such as the group size and the approval for care over 30, specifically apply to any childcare, whether it is licensed or exempt from licensing. And we recognize that camps are different from preschools or other early childhood childcare. They're not the same. But during this pandemic, any childcare is being regulated consistently for public health reasons. as Commissioner Bye mentioned.
Thanks, Mike. So for our organizers, if you could make sure to mute your phones, I think that's where we're getting some of our background noise. I apologize. We did hear from attendees that you were hearing some background noise. If our organizers can just be sure to mute their phones. So Commissioner Bye, we have a question around, where did it go? Sort of the timing of the changing requirements, either certifications that need to be renewed now, should people are asking for advice about how to proceed with first aid certifications, lifeguarding or lifeguarding certifications. I think the guidance is probably proceed as though you're opening,
yeah,
but
I would, if you plan to open, I would proceed as if you're opening. I know that the Red Cross was working on making more online classes available. I don't know how you do that with lifeguards, et cetera, but I know they were working to make it more accessible. But I think you continue with that, and also be aware that if you have a camper whose certificate is going to lapse this summer, at this point, we are recognizing those, understanding how difficult it is. So a lot of it just depends on the timing. If they don't have a certificate at all, we can't extend it.
There are some questions around the difference between, I know I raised this already, the difference between day camps and residential camps. And one thing you had mentioned earlier is that the requirements are not different, but that the application of the requirements in residential camps may be a challenge. We have some questions around the availability of testing, citing the fact that residential camps are really closed environments, and so it's possible that if kids are tested before they arrive, then it's possible that they're sort of self-quarantined for the duration of their stay. So I don't know if you're able to speak to the availability of testing for those purposes.
Well, I cannot speak to that. I can say that it's a big focus of Reopen Connecticut, and the questioner makes an excellent point. One of the challenges with this disease is even the tests have a lot of false positives. I don't know about false negatives, but it is a sneaky one. That's why we're in this situation. So, but it's a really interesting point about testing, and it's if you watch the news at all, you know this is a national problem that does not seem to be being resolved quickly. But I do know Governor Lamont is working very hard to get as many tests as possible for purposes of reopening. Look, we all, parents need Connecticut to reopen, businesses need Connecticut to reopen. I think there's certainly a lot of momentum toward how do we do this, tempered by how do we do it safely. And unfortunately, the timing of camps sort of falls right in the middle of some of these decision points. But I will bring that point about testing to the meeting with the governor's team around camps and residential camps in particular.
Will programs who need a preliminary inspection be able to have a preliminary inspection?
I'm going to ask Deb Johnson. Yeah.
Sure. We will, if a camp needs a preliminary inspection, we will send someone out and conduct that. That's not a problem.
Thank you, Deb.
I'd also like to just clarify as far the question in regards to training certificates. In the memo
please.
18, it specifically indicates staff training. It says including first aid, CPR, med admin that expire during the emergency, that we'll consider those acceptable. That's not an all-inclusive list. We're also including there activity specialist training, such as lifeguarding or archery. So if it does expire, we will recognize that if it expires during the declared state of emergency.
Thank you for the clarification, Deb.
We do have a few questions about the May 20th date right now that's on the calendar about school and whether there is any information about that date and updates.
I do not have any new information about that date. I know, like everything, they're evaluating that every day, and communities are evaluating that as well. I was on the municipal call this week, and that was a common question of towns about are schools going to really reopen? And we just don't know yet.
I just wanted you to say that because I think that that unfortunately we don't have new information.
Right, but what I would say is to remind camps that we are allowing camps, you know, if schools make the decision not to reopen, whereas camps can operate, some camps are operating now under the enhanced public health guidelines. So I know that the finances are not at all the same and that there are tremendous challenges. But I do know like a camp has stepped up to help us with Project 26 and provide care for workers at Stanford Hospital. So I do know there are camps that are really stepping up for essential workers. So that is potential if they decide schools do not reopen. And Deb, if someone wanted to do that, they would need to let OEC know, correct?
Right, under their current license, if they plan to operate for dates that they didn't previously inform us of, all they have to do is go to the website, download the report of change form, fill that out and send it to us, and then they're good to go.
Okay, thank you for that clarification.
I'm going to put a link in the chat window to all of the memos that we have been issuing and the communication we have been issuing. I don't know if Deb Johnson, you might be the best to answer. Who should, after this webinar, who should folks contact directly so that they can either ask very specific questions or be added to make sure their email addresses are updated in our system?
They can call the general camp line, which I would guess they're familiar with, or our help desk line is 1-800-282-6063 or 860-500-4450. And that's a phone tree where they can push for camp, and we're retrieving those calls. There's no one in the office to pick up, but if they leave a message, one of the camp staff will get back to them with an answer.
Can you say the second number again?
Yeah.
The second number, 860-500-4450.
I also wanted to just add in for our listeners that for what it's worth, that we have had the hires of our temporary camp staff approved by the Office of Policy Management. So we are acting as if camps will be open and preparing for camps to open if with enhanced guidance, public health guidance.
At this point, we've covered the themes in the majority of questions, but we do have some questions about future communication, and so we've been sort of playing that as it's come with our other programs as well. So I don't know if you want to speak to future communication that we'll have with the youth camp community, future memos.
Yes, I mean, we are happy to keep regular communication going. I know that certainly we've met with camps a number of times this year. I have, and we are issuing memos every few weeks. So, and things are changing quickly. So let us know if this was a useful format. And also, if you have questions, because then we can put them in a frequently asked questions in the frequently asked questions section of our website. And we will be communicating through email and our website as things evolve. But we are happy to host another one of these. And, you know, this was our first camp memo, so we don't have any regular communication there. But as things change, we are happy to.
So for folks who are on the call, thank you so much for your participation and engagement. We review all of the questions that you've submitted. We will be formatting them together, as Deb Johnson said, in a frequently asked questions document that we'll post on our COVID-19 website. So if you didn't hear your exact question read, just know that we have it. We hear your feedback and we appreciate your creative solutions.
Yeah, thank you, Rachel, so much, and to our team. But I just want to be really clear with camps that we understand that you're very different than a child care center for an infant or toddler or preschooler. Like, we totally get that, and our guidance that we use is going to reflect that. As I've said, our guidance is based on the CDC guidance for schools and child care, and to be honest, it's almost all the same, because it's about keeping groups small, washing hands, screening, face coverings. It's very much the guidance being given to adults. And so changes to the camps will be related to that. The other thing is, everything we develop, the guidance is done in collaboration with the Department of Public Health. So though we oversee child care too, we oversee camps. And in both cases, we look to the Department of Public Health to issue that guidance. So I just wanted to end by saying we understand things are different, and I can tell you the governor is thinking about camps as different. You do actually provide childcare for tens of thousands of kids in the summer and for families. So we're really lucky to have you. And some of you are not full day, et cetera, but you're providing enrichment experiences for families. So I want to close by saying we see you as part of the infrastructure right now in Connecticut, and we are grateful that you are being proactive and asking questions and reaching out, and we'll do our best to communicate with you. And maybe it would be useful if we check in 2 weeks after Reopen Connecticut issues some guidance, because I do think the camps are part of it. And, we're all in this together. These are really hard times. I know OEC has lost folks who are contractors for us to this terrible disease. And I hope you all are staying safe. And we're going to do our best to try to support children and families and support public safety. And we also know that many times kids are safer when they're at camp because some would be left home alone otherwise. So we understand your role, and we're all going to do our best. And I'm really grateful for your participation. Thank you so much.